Hello everyone. We are the group 2, and today we are going to present to you or report to you about data, information, and knowledge, and especially its relation to nursing. Next slide, please. First is roles of ICT in nursing. First is improved dissemination of public health information and facilitated public discourse and dialogue around major public health threats. Next is enabled remote consultation, diagnosis, and treatment through telemedicine. Third, facilitated collaboration and cooperation among health workers, including sharing of learning and training approaches. Next would be supported more effective health research and the dissemination and access to research findings. Next is strengthen the ability to monitor the incidence of public health threats and respond in a more timely and effective manner. And lastly, improve the efficiency of administrative systems in healthcare facilities. So to sum it all up, this translates into saving lives and resources and direct improvements in people's health. In Peru, Egypt, and Uganda, effective use of ICTs has prevented avoidable maternal deaths. In South Africa, the use of mobile phones has enabled tuberculosis patients to receive timely reminders to take their medication. In Cambodia, Rwanda, South Africa, and Nicaragua, multimedia communication programs are increasing awareness of how community responses to HIV and AIDS that can be strengthened. In Bangladesh and India, global satellites technology is helping to track outbreaks of epidemics and ensure that effective prevention and treatment methods can reach people in time. Experience demonstrates that there is no single solution that will work in all settings. The complexity of choices of technologies, as well as the needs and demands of health systems, suggest that the best way forward is to globally introduce, test, and refine new technologies in those areas of healthcare where there is a reasonable expectation that ICTs can be effectively and efficiently used. Some innovative leaps may also be possible as technology is evolving rapidly. Some of the trends identified that suggest new opportunities, including wireless applications, increased use of mobile telephony, and combinations of technology working together.
So for the data versus information. So for the data is unorganized and unrefined facts. For the information, compromised, processed, organized, presented in meaningful context. Data is an individual unit that contains raw materials which do not carry any specific meaning. For the information is a group of data that collectively carries a logical meaning. Data doesn't depend on information, for the information depends on the data. So measured in bits, the bytes, it can be represented in structured, unstructured tables, graph, trees, etc. And it doesn't have significance until it analyzed to meet a specific user's needs. For the information is measured in meaningful units like time, quantity, and etc. For the data, raw data alone is insufficient for decision making. For the information is sufficient for decision making. For the data, an example of data is students' test score. For the information, the average score of the class is the information derived from the given data.
Number three, what data, information, and knowledge is in relation to nursing care. Information technology is transforming the healthcare field with a plethora of new tools, software, and devices. This transformation has especially affected nurses, which is why healthcare information technology is often referred to as nursing informatics. Nursing informatics is used in practice settings to help organize and apply data, information, knowledge, and wisdom. The continuum of data, information, knowledge, and wisdom show how nurses use facts to make decisions and provide care. This continuum provides insight for how nursing informatics contribute to different levels of understanding, decision making, and evidence based practice. The lowest level on the continuum is data. The term data refers to discrete sets of details related to a specific situation, patient, or population. You can think of data as isolated islands of facts that any observer would be able to view and objectively identify. The next level on the continuum, directly above data, is information. Information is the result of processing and organizing data into more manageable structures and interpreting the meanings of individual data points. Information systems such as electronic health records compile data and support nurses at the information level of the continuum.
To continue, after information, the next level up is knowledge. Knowledge arises when information is synthesized into formal relationships and interconnections. Knowledge involves recognizing patterns and abnormalities based on separate sets of information. Nursing informatics that operate at the knowledge level are called decision support systems. Finally, the highest level of the continuum is wisdom. Wisdom is the application of knowledge to addressing clinical problems and complex patient health issues with compassion and regard for ethics and quality of life. So let's explore a clinical example of how data, information, knowledge, and wisdom build in each other. Consider a 48-year-old male patient of average height who is slightly overweight. The patient's recent blood test indicates that he has impaired glucose tolerance and slightly high cholesterol. All of these initial facts about the patient represents data. The nurse discusses the result of the blood test with the patient and invites him to return for a follow-up visit. The second blood test indicates higher glucose levels and the same high cholesterol. This serialized blood test results represents information. The nurse then takes this information, refers to the patient's electronic health record, and discovers that the patient has a family history of diabetes. This data, added to the information from the blood tests, allows the nurse to determine that the patient has type 2 diabetes. The diagnosis is knowledge, and finally, the nurses uses wisdom to determine the most appropriate strategy for addressing this patient's diabetes. Because the patient does not have a personal history with diabetes and is relatively young, the nurse discusses lifestyle interventions to manage his glucose levels. If after 6 months the patient's glucose is not within normal range, the nurse and the physician will consider medications and other treatment options.
For the last question, we have describe the relationship between data, information, and knowledge. For the data, data is comprised of the basic, unrefined, and generally unfiltered information. Data must be organized to become information. Data is a set of discrete, objective facts about events as structured records of transactions, factual information used as a basis for reasoning, discussion, or calculation. Information output by a sensing device or organ that includes both useful and irrelevant or redundant information and must be processed to be meaningful. And lastly, information in numerical form that can be digitally transmitted or processed. For the information is much more refined data that has evolved to the point of being useful for some form of analysis. Information must be put into context to become knowledge. Information as message in the various form of communication to have an impact on judgment and behavior. The communication or reception of knowledge or intelligence. Knowledge obtained from investigation, study, or instruction. Facts and data, quantitative measure of the content of information. For the knowledge resides in the user, happens only when human experience and insight is applied to data and information. Knowledge is created by the very flow of information anchored in the beliefs and commitments of its holder. Knowledge is a fluid mix of frame experience, values, contextual information, and expert insights that provides a framework for evaluating and incorporating new experiences and information. Cognizance. The facts or condition of knowing something with familiarity gained through experience or association. The range of one's information or understanding, and last, the sum of what is known, the body of truth, information, and principle acquired by mankind. In conclusion, the definitions reveal the differences and a process can be identified that transforms data to information to knowledge through appropriate processing data steps. Data transforms into information by assigning a meaning or context to a data. Furthermore, the accumulation of data bundle or the linking of various data can also represent information. The moment the information is processed and linked, stored, whether by a machine or a human being, it becomes knowledge. And if you trace the path back, the data represent the knowledge and information at a formal level. That would be all. Thank you.